It's my great honor to be able to welcome you here tonight on behalf of the President and Vice Chancellor of the University of Calgary, Dr. Elizabeth Cannon. We're very proud at the university to be associated with this wonderful event, and I'm very much looking forward to hearing the panel. And it's tremendous to see such a robust crowd on such a cold evening. I think, however, that the coldness of the evening was almost designed to help us think about the subject of tonight's discussion and allow us greater empathy for the state of the homeless in this city and elsewhere. Before I come back to say a word about our theme tonight, I'd like to thank our Chair of Christian Thought, Dr. Doug Chance, for his leadership for this event and for many others that have been associated with the work of the chair. This evening and the work that Doug and his colleagues in religious studies and others connected to this endeavor do on our behalf link directly to the university's strategic priorities, which have been articulated by Dr. Cannon in what we refer to as the eyes high goals and strategies. We want at the University of Calgary to be one of the top 5 research universities in Canada by the time of the university's 50th anniversary. We want to be a leader in innovative and engaged teaching and learning. And we want, more than anything, to be more engaged and more profitably engaged with the communities that we serve and lead. So the event that you're here for tonight touches all of these components, and certainly the work of Doug as Chair of Christian Thought encompasses all of these activities. What we're going to hear tonight speaks directly to the research mission of the university, which involves not only the research that we often hear of that's in medicine and engineering, but in the Faculty of Arts we have a breadth of research activity in faculties like social work, nursing, law. We engage with curiosity-based research, but we're also active, as you'll hear more tonight, in community-based research, where the work of scholars interacts with the problems of the communities in which our institution is located, and where the communities that we represent engage in important discussions about social, political, economic, cultural, aesthetic debates. And we as a university want to help lead these discussions, these debates, these confrontations with some of the most difficult challenges that we face as human beings. Secondly, research at the University of Calgary is not disconnected from teaching and learning. We want our students who come to the University of Calgary to have the full range of experience from the undergraduate to the graduate level, and it's wonderful to see many students that are here tonight that will be able to go back to their classes filled with a greater appreciation of the work that's being done and the ideas, perspectives that could be shared around such a crucial issue as this one. And finally, and probably most directly for this evening, we at the University of Calgary are committed to becoming more and more profitably engaged with our community, the community of Calgary and region. And again, it's so wonderful to see so many people out here to discuss and to confront such an important issue as homelessness. We thank our friends here at Central United. We have had a long and very profitable relationship at this university with the oldest church, I understand, in Calgary. And there aren't very many old things in Calgary, I'm finding out. I've been here for a year and a half, and it seems that this is still very much a city that is always building and always looking forward. But it's also a city that very much cares for its citizens, cares for its community, as we saw last year in the flood, as we've seen in all of the events that we've put on that have engaged the community in very difficult social issues. And homelessness is one of those. I come from Winnipeg originally, both born and raised there, and then I was back there for a few more years, most recently as Dean of the Faculty of Arts. And in a place like Winnipeg or Toronto where I lived, or in British Columbia where I lived previously, you can't escape homelessness, and it's very much part of the social commentary. It's a part of your life almost any time you go out and go downtown. In Calgary, a little bit less so. My experience has been that the homelessness as an issue hasn't risen as high on the public priorities as, frankly, it should. And so it's very good to see that we're engaging with this issue, because it's an absolutely crucial and fundamental one when talking about social justice, when talking about the quality of life in a community. And so I'm so respectful of the individuals who are going to be sharing with us today, their knowledge, their perspectives, and I'm so thankful to all of you for coming to engage on this tremendously important event on such a cold night that again drives home the point that there are friends and fellow citizens out there who are having a hard time finding a place. And this is a matter of economics, yes, of legislation, yes, but it's a problem of very, very many dimensions. And again, I'm looking forward to hearing more about that and learning more about that from this very stellar panel we have tonight. So again, welcome, thanks for coming, and I know you'll have a wonderful evening.
Thanks very much for those words, Richard. And good evening. My name is Tinu Ruparel, and I'm the head of religious studies here at the University of Calgary. I won't spend too much time talking. I just want to tell you a few things before we hand it over to our chair and moderator for tonight's discussion. I'd like to tell you a little bit about the Chair of Christian Thought. The chair was founded 28 years ago through the generous support of 4 Christian denominations in partnership with matching funds with the province. And since then, with other denominations, we have together created a unique town and gown partnership. Now, it's difficult to overestimate or overstate just how unique this kind of thing is. It's an ecumenical group of Christian communities partnered with a department for the academic study of religion in a secular university. I know of no other chair worldwide that is as successful as ours in this kind of endeavor. And we in Religious Studies and the Faculty of Arts are really proud of the work of this chair. And this is in no small part due to the tireless work of our current chair holder, Professor Douglas Shantz, who, after Gordon Harland and Alan Sell, is the 3rd person to hold the position. Through the work of Doug and his predecessors, the chair has brought to Calgary some of the most influential and important thinkers in the world to share their ideas and research with students, scholars, and community members. We're really fortunate to have the opportunities that the chair makes possible to learn from and converse with the Christian thought lecturers, panelists, and presenters, and not least from the distinguished panelists today. Of course, making these opportunities possible takes considerable resources, and I'm pleased to share with you today our desire and plan to expand the work of the chair to become a center for the study of Christianity and culture. Religion plays a greater role than ever in today's world. No doubt you'll have heard about the debate surrounding the Quebec Charter of Values. This is just one of the many examples of how questions of religion challenge our understandings of what it means to be Canadian, secular, democratic, and multicultural. Our goal is to expand the role of the Chair of Christian Thought to become a center to engage with research and teaching these and other such questions, both religious and non-religious, and indeed encompassing all of the world's religions. In order to inform our understanding of these issues, and to train the next generation to meet these challenges. I'd like to invite you to consider making a gift to the Chair of Christian Thought. You can do so in 3 ways: by contributing to the endowment of the chair as it becomes a center, and this would guarantee its resource and place as a resource and guide for subsequent generations, and that is your children and grandchildren. By contributing to the annual fund so that we can continue putting on important events like tonight's panel discussion, or perhaps becoming a member of our legacy circle to become a long-term supporter of the work of the chair. So you can get more information about these things on our website, or please come and speak to me or Doug afterwards. But without further ado, let me introduce Professor Douglas Shantz to the podium to introduce our panelists for tonight. Doug Shantz is an internationally recognized expert on Reformation history, and in particular, German Pietism. His latest book, called An Introduction to German Pietism, is the first English-language survey of the field in over 40 years. And Dr. Shantz was recently honored with an invitation to deliver a plenary lecture to an international conference on German Pietism this last year. And he did it in German, no less. We are very proud to have him as our chair and our moderator for tonight. Doug.
Good evening. Thank you, Reverend Ward, for hosting us this evening in this beautiful church. It's my first time here, and it's certainly an impressive facility. Thank you for coming tonight. How many attended the panel a year ago at the Cathedral Church? Just curious. Just a few blocks away. It was, again, a good crowd on that evening as well. The format this evening is the usual one. We have some tremendous content that we'll hear in this coming hour from these panelists. Each group will take about 15 minutes, and then we'll have questions. And following that, informal discussion around some refreshments. Some of you, I hope, got a copy of this interesting work of art. How many of you received that and heard about this? It's fascinating. You know, that 2 of the Gospels refer to Jesus' words, "The foxes have holes, the birds of the air have nests, but the Son of Man has nowhere to lay his head." Jesus was essentially homeless for his career. And so I think it's appropriate the Chair of Christian Thought is thinking about this phenomenon. So very quickly, I want to introduce all of our panelists, and then I'll turn it over to them. On my immediate right is Danene Lenstra, and next to her is Shannon Jones. And they're going together to represent the Alex Youth Center and their work on the front lines. They represent, in some ways, I think the most unique perspective that we have this evening in working with homeless youth in Calgary day to day. Danene was interviewed and ranked among Calgary's top 40 under 40 in 2011 in the Avenue magazine. And there she reflected on the fact that some 2,000 youth, she relates to some 2,000 youth in a year in Calgary who are homeless. Shannon is co-worker with Danene and team lead of the program at Alex Youth Health Center. She's also co-chair of the youth sector of the Community Action Committee on Housing and Homelessness here in Calgary. Next to Shannon is Jeannette. Jeannette Waegemakers Schiff. Jeannette has degrees from University of Toronto and Columbia. She is a professor of social work at the University of Calgary. She is a member of the Canadian Homelessness Research Network that is devoted to enhancing policy decisions in Canada that reflect the insights of research on this important issue. Jeannette works with issues of housing, mental health. Prior to joining the University of Calgary, Jeannette worked in New York City in their Housing First program called Pathways to Housing. And then next to Jeannette is Alina Turner. Alina is one of North America's leading homelessness researchers and thinkers. She has degrees from the University of Alberta, and more importantly, she has a PhD from the University of Calgary in the field of anthropology. Her PhD thesis focused on housing among migrants to this city. Before her work as a consultant, from 2008 to 2013, she was an executive with the Calgary Homeless Foundation, an organization that implements Calgary's 10-year plan to end homelessness. She managed a budget of $35 million and worked with both government and nonprofit sector groups on this issue. In 2013, she began a consulting company to look at issues around development and social causes and social change. And finally, on my far right is Stasha Huntingford. How many of you heard Stasha today on CBC? Stasha has degrees in social work, 12 years working directly with young people on the street. She gives presentations on this topic regularly on issues of frontline dilemmas, drug recovery. She authored a book called Radical Hope in Youth Recovery. This past December, when I first contacted Stasha, she said, "I can't communicate now. I'm preparing for my comprehensives, for candidacy exam." So I waited till December 10th? Yeah, see. And then we got in touch and we were in conversation. Her dissertation focuses on the intersection of theory, practice, and policy, the benefits of having frontline workers evaluate how governments are implementing policy. So I'll turn it over to them. Let's welcome our panel.
I guess I can just start. It is cold out, and actually as I was walking, I was running because I was late, along 7th Avenue, and the cold was going in my lungs. I thought, oh, I shouldn't be running, it's going to make me cough, so I'm sorry if I cough. And then I was thinking as I was coming up the stairs, oh, I hope that door isn't locked, I hope that door isn't locked. And it wasn't. So that sort of does put a little structure around my talk, how nice it is not to come up against a locked door when you're cold and in pain. So thank you for having us here. It's an honor to speak to you on behalf of the Alex Youth Health Centre and the young people we serve. I often speak on behalf of the Alex Youth Health Centre, and I think one of the reasons that they keep me around is because of how much I enjoy talking about the work that we do and the clients we serve. I'm sharing my time with Danene, who's my boss. This is Danene. And the way we generally work is that I talk, and she fills in the spots that I miss, and then takes over if I get too emotional and can't form words. I hope our system works for you, and you get the information you need from us. I have spent the last year and a half at the Alex Youth Health Centre as part of a United Way funded learning initiative that's exploring how we as professionals can help activate natural and family supports in the lives of our youth. So tonight I'll talk a little bit about that and about some of the underlying issues of homelessness that we've encountered, as well as what we offer to the youth based on what we believe that they need. Maybe some of that can inspire you or inspire some great questions on the topic of youth homelessness. I hope by the end of my few minutes that you'll have a better understanding of the issues that we see in working with youth who are homeless and know more about what we're offering to do our part in the issue. On my PowerPoint, I have some pictures of the clients that we serve. Danene's our program lead, my boss, and a very talented photographer. The Alex Youth Health Centre technically serves youth between 12 and 24 years old. However, some of those 12 to 24-year-olds have children of their own. So the real young ones you see in the photos also become part of our demographic. So the first thing I want to talk to you about is that word, our. Recently, I was challenged by another professional on the use of that word, our. The argument from that professional was that these youth belong to someone else. They belong to a family or a community, and after some deep reflection, I agreed that they do. In the beginning, there was a family and a community. One of the jobs of a family and a community is to comfort, protect, and teach children how to become healthy and successful adolescents, and then assist those adolescents to transition to adulthood. For some of our youth, it seems that they have somehow been lost and that connection, from that connection and support. And by the time they get to us, they need to belong back to someone. So we're happy to be that for them, for those that need a place to belong and people to belong to. And we can do that until there is a family and a community to give them back to. For a non-homeless youth, the place that they practice becoming and being themselves is within their families. Testing happens all along their maturation process and is matched to their developmental stages. The first moments of mother-child attachment, the feel and smell of skin, the reactions of family and community to this new person in their lives. The responses to first vocalizations and cries and smiles give an infant information about themselves and where they fit in the world. The way that the family receives the wildly passionate love hugs and tantrums of the 2- and 3-year-olds, or the secrecy and sometimes regressive need for reassurance of the pre-adolescent, all the way to how a family reacts to overt or covert displays of rebellion and quest for independence of the adolescent, is working through a somewhat consistent manner and gives the young person information about who they are and where they fit in. In a healthy family or community, members instigate, encourage, support, endure, barely tolerate, give feedback, and set boundaries for their youth, all the while providing the youth the necessary tools for them to become themselves, and in becoming themselves, make connections to others who then become their supports, and this keeps the family or community growing and changing. For a vulnerable youth, there's some sort of upset, an interruption that does not allow the youth to work through these stages and or get the feedback that they require to realize their potential in interpersonal relationships. I have a feeling that that Margaret Wheatley's quote that said it's all about relationships is true. The upset prevents the youth from getting the support and guidance they require to become and share their true selves with the rest of the world. This may happen because the youth is not able to truly reveal themselves to their families, and it may be that the family or community just does not have the skills to provide appropriate feedback along the maturation process. Now, I struggle with all of the descriptors that we currently have to describe the young people we work with. I mean, look at their faces. Some of the words, homeless, vulnerable, street involved, at risk, marginalized, addicted, or in the past, words like delinquent or troubled, might describe the current situation those youth find themselves in, but those descriptors don't even begin to scratch the surface of what has gone on, what is going on, and what is yet to come. All of those words don't seem to do justice to the diversity of the youth that we see. The Seeking Sanctuary study that was done right here in our city identified some push and pull factors that could lead to youth homelessness. Push factors of family conflict, family structure, poverty, abuse, neglect, learning and developmental disabilities, and alienation. And pull factors of youth substance abuse, boyfriend-girlfriend relationships, and street cultures. All of these come into play for the youth that we serve at the Youth Health Center. Often one feeds into the other, and to unravel the path and to find the reason for homelessness or vulnerability is like looking for the chicken or the egg. I've come to understand that when I say our, what I want to inspire is an understanding that these are our youth, yours and mine. They are diverse in their needs, and they need all sorts of different things, different people in different programs in different time frames to get them back home. And I define home as a place that is a safe place, that is permanent if they want it to be that, and allows them to do the developmental work of adolescence. So for me, home is not housed. Housed is really, really, really important. Housed is the beginning of home, but homed is much more than housed. We can provide our youth, yours and mine, with what they need and what they require to get there. We are their community, and so can take the steps to care for them. So a little bit about the Alex and what we do to do our part. We recognize how incredibly lucky we are to do the work that we do. The youth who access our services are our teachers. They teach us about loss and grief, about stigma, and they teach us about hope, strength, and resiliency. Every single day that a young person shows up asking for another housing referral, another food hamper, or another hour of our time is a gift. All of our kids have a glass half empty and a glass half full story. We advocate and champion, we encourage and cheer, we guide and we teach and we love. Our young people have potential, so much potential. The part we play in helping them reach that potential is through professional, social, emotional, and medical support. We have medical services 5 days a week and access to an on-site psychologist. We would love it if all our youth were in a position to make and keep appointments, but not all are, so we're very flexible to give them the access they need to necessary medical care. Our medical services include everything that you would get from your family doctor and prenatal care. We also do lots of STI testing, and although that may not seem great when you first think about it, it is important to remember that youth sexual behavior has not changed significantly in the last 30 years, but what has changed are the sexually transmitted infections, rates of infection, and the potential negative health outcomes, as well as opportunities and places for exploitation to happen to vulnerable young people. We also help with resumes, job search, housing searches, education applications, Alberta Works applications, AISH applications, and status cards. We have a bit of funding to pay for ID, and when that runs out, somehow Danene manages to find other money to still pay for the rest of the youth that need ID. We fill out emergency applications for prescriptions and apply for healthcare related funding. When those sources cannot provide the funds necessary for medications, we pay for medication that our youth need to achieve their wellness. We have a drop-in that has a table with always has food on it. We get lots of support to help feed our kids. Brown bagging for Calgary's kids, the food bank, all of them help, and we never forget that we couldn't do it alone. We have outreach. We have workers that attend home visits, court accompaniment, visits in the Calgary Young Offender Centre and in remand. We place the highest value on mutually respectful, nurturing, loving relationships with our youth, and we focus and refocus ourselves on the youth's needs and their strengths as a place from which we start our work. We have a worker that focuses on pre- and postnatal clients. We have a community kitchen once a week. We have a mobile team on our bus that reaches out to youth where they're at which we hope is at school. We pride ourselves on being a safe place and safe people for youth to come and access for physical and emotional care. I want to take this opportunity to extend a warm and open invitation for each and every one of you to come and have a tour of our Centre Street location and see firsthand what we're doing there. We all have something to offer to our young people. We are the village, and we can assist the younger members of our city, of our community, to have the advantages that being part of a healthy community offers. To have assistance through encouragement, support, tolerance, feedback, and boundaries so that they develop tools to become themselves, and in becoming themselves, make the connections to others that will keep our community healthy and growing and changing. One of my favorite people in the world has a tattoo that says, "Apathy killed the humans." Thank you for not choosing apathy. Thank you for being here. Thank you for caring.
Anyway, I very much am honored and humbled to be here. I hope I'm not going to speak too long. I will not bore you to death by PowerPoint because my PowerPoint is sitting in the trunk of my car and it was too cold to go back and get it. So I'm going to try to do this from memory. There are some lovely pictures if you want to throw them back up, but if not, you'll have to deal with these pictures and we'll go forward. So I was asked by Doug if I could spend a little time talking about homeless youth and trauma through the eyes of homelessness and through the eyes of youth. And, excuse me, I've been involved in looking at homeless issues for quite a number of years, but it wasn't until about, I'd say, a year and a half or two ago, when I was deeply involved in beginning to write out more of the details of working with a variety of different people, that I became acutely aware of the extent to which trauma is a factor that plays into the lives of those who've experienced any kind of housing instability or homelessness. What made it even more acute was the fact that for homeless youth, almost all homeless youth will either experience trauma before becoming homeless or after becoming homeless. There was a study that was done out in Fredericton that looked at great depth at the lives of homeless youth, both before and after losing housing. And when we're talking about trauma, I'm talking about something very specific. I'm not talking about a bad experience. I'm talking about the kind of life experiences that really place an individual at risk, at fear for their life, for their personal integrity, whether that is physical integrity or psychological integrity. I'm talking about those kinds of experiences where someone has witnessed someone either dying suddenly, being subject to some kind of severe accident, or they're personally involved in an accident. I'm talking about trauma as being the victim of continual and severe physical, mental, or sexual abuse. I'm talking about trauma that is perpetrated by one human being to another, for the most part. We all know of traumatic events that occur when they're acts of nature, but the traumatic events that occur when they are wrought at the hands of another human being are particularly difficult. And when they're experienced by a young individual, not only does it leave that individual with profound, long-lasting scars, emotional scars, we also know from some pioneering work that was done by a neuropsychiatrist by the name of Bruce Perry down in Texas, and he spent some time up here in child psychiatry with Alberta Health Services. But we know from Dr. Perry's work that traumatic events can impact the developmental process inside the forming brain. And if we remember that our brains are not totally formed until age 24 or 25, then we can again appreciate the fact that any kind of traumatic experience that a child has is going to impact them. So what does it mean to be impacted by trauma? It means to experience feelings of fear, of anxiety, of helplessness, of hopelessness, of depression, of powerlessness. And so a young adult, as that young adolescent to young adult, tries to struggle with developing relationships, both within the family and outside of the family, when those family relationships, again, may be impacted through all kinds of negative experiences, which we can label traumatic. We wind up with a young adult who then seeks outside of the family to find some other ways of coping. So homeless youth come, many of them, with traumatic experiences. We know that for many young males, those traumatic experiences can be more of a physical nature, although they can also be of a sexual nature. For females, often the excuse has been in terms of sexual exploitation. And if they didn't have those experiences before they hit the streets, they certainly hit them afterwards. So what does all of that mean in terms of trying to help these young individuals as they seek to try to find some kind of life? As we have to try to remember that these individuals are part of our future. They're part of a growing generation, and if we don't help this generation to begin to grow and develop in positive ways, they are going to be left at the margins of society, unfortunately, along with other people who find themselves marginalized and have difficulty getting out of that particular trap. And so too often we've thought of homeless youth as angry, rebellious, unwilling to adhere to the rules of society. Well, what if we put on a trauma lens? What, instead of looking at this behavior as just being an angry youth, we look at it as an understandable, predictable, natural, normal reaction to the kind of horrific experiences that a lot of these young folks have faced. I'm not talking about 100% everyone who's homeless, but I'm certainly talking about the vast majority of homeless youth. So if we look through a trauma lens, I think that we then begin to see that there are different ways that we can help and approach these youth. That we can see that their behavior is the understandable coping mechanisms that have been used to try to survive very difficult and unusual circumstances. That we have to then, in our outreach efforts and in our efforts to try to help these youth, to develop approaches that look at how we can best help to provide them with a sense of safety, to understand that trust will be something that comes very slowly and over a period of time, it's not automatic, that it may take several different attempts by several different individuals or adults before that particular youth can form a meaningful and trusting relationship. It doesn't mean that each person along the way has failed, but each person along the way may be a stepping stone to ultimately helping that individual to form relationships from which they can move forward. It means, so that's what it means on a personal level. I know that Alina and Stasha are going to talk more about what happens on a systems level, because I think that this is part of the issue and not the total issue. But we have to start by looking at these kids as kids who are in need. I'm reminded of, didn't used to think of them as homeless. It was just a friend that my 16-year-old daughter brought through the door one day and said, "Mom, this is Jamie and he needs a place to stay." And Jamie stayed with us for about 6 months. Jamie ultimately moved on. I thought at the time that it was a failure on my part that I hadn't been able to provide enough of a stable home that he would stay in. But I came to recognize over time that Jamie needed to make several different attempts at stability before he found the right one that would work for him. He was a child who had been brought up in a single-parent home, whose mother had died when he was at a young age from cancer. His subsequent caregivers were his elder siblings who had their own emotional difficulties and couldn't look after him. He had been abused physically and sexually by mother's boyfriends before she died. So he had had a whole legacy of instability, insecurity, and traumatic experiences. I hope at this point Jamie, who would be an adult in his 30s, has settled down to a more stable lifestyle. But Jamie has a humanity about him. And I think for me, he represents a part of what a homeless youth is all about, someone who needs to have a caring place, and yet at the same time to have individuals who recognize that the struggle that he or anyone in his situation has are very deep struggles, and they're not just struggles with being, quote, badass kids, and they're not just struggles with being substance abusers. Yeah, Jamie's a little pot in the side, but as far as I'm concerned, excuse me, everybody, no big deal compared to everything he could have been involved in. There could have been an awful lot worse. So we have to put some kind of perspectives on this. So that is my message in terms of working with homeless youth, is remembering that so many of them have come through so many traumatic experiences that we have to look through a traumatic lens of how we can begin to help these youth to pull their lives together. Okay.
Everyone. I do have a presentation as well, and it's up. So we haven't worked out a secret signal, but I think we can swing it. So thank you very much for having me tonight. And my presentation is going to build on the excellent points made already. But what I really wanted to focus on, and secret signal, next slide, please, is moving from a program-by-program approach or agency-level response to a systems response to youth homelessness. And I'm glad we have a member of the Provincial Assembly here with us tonight, because a lot of the pathways into homelessness and the ramifications of homelessness that we have already been discussing, they have roots in our public policy and in our public systems like corrections, health, child intervention, etc. So it's about the response that we create at that level and how it articulates with the emergency responses and the really good frontline work that's happening once youth already become homeless. And that's the work that I'm really involved in at the national level through the Homeless Partnering Strategy, and it's designing system responses across communities in Canada. And Calgary's, one example of that type of work, but Jeannette and I do work in rural communities as well, and the experience is always somewhat contextualized, and understanding the macroeconomic forces, how public systems intersect at the local level, all that's really crucial to understanding how we ultimately end youth homelessness. So next slide, please. The other piece that I wanted to touch on today was basic numbers and figures for you. You've heard about the experience of youth and the individual faces and stories already, but sometimes painting the picture with numbers gives you a sense of the magnitude and prevalence of the issue, and it gives you a sense of the use of research and practice as well, and the use of research in public policy, because it's again the research and action that helps move public policy oftentimes. And that's one of the great experiences that I had out at the University of Calgary, and they're not paying me to say that, but it's really about taking research and making it make sense for policymakers, for frontline staff, and for system planners with respect to a particular issue. So I will give you a sense of the magnitude of youth homelessness in Calgary, at least from what we know with the most recent research and figures. And I also wanted to touch base with you on some of the progress being made from a system perspective in Calgary as well. And if there's time and interest, we can discuss what's happening internationally and across Canada as well. Next slide, please. So, okay, we skipped the slide, but that's okay. I can take it from here. The previous slide is just a note on definitions, and my point around that is that definitions are again very crucial when we talk about social issues and how we frame, how we discuss an issue. Saying the 24-year age in particular is something I wanted to pick up on from what the other speakers said. And youth don't mature at a 16 or 18. It's hard to put a particular numeric figure on saying that this person is now independent. And when we looked at research on youth homelessness, we saw that often systems failed to recognize that transition to independence is not a hard break, right? So a lot of public support and a lot of agency and frontline supports put this fake limit to when support ends for a particular individual. So I wanted to really emphasize that in our definition of youth homelessness, it's extending that definition to as long as the youth needs that support. And that can be 24, 25 years. The importance of that is that in our current public system, youth stop getting supports at 18. Some of them can get some supports up to 24, but again, without having a recognition of the need to change definitions in legislation, we're only going to be partially successful. So that's what the slide was that we missed. With respect to youth homelessness in Calgary, it was mentioned that 2,000 youth every year experience homelessness. That came from a study I did back in 2009 with the youth sector in Calgary. And you know, as good as our estimates are, they're really just estimates. When we did a homeless count at different intervals in Calgary, 21% of those enumerated are youth, so and that's up to the age of 24. And in 2012, there were 721 young people, and those up to 24 and younger that were homeless in our city. And the importance of that is that it's only a point-in-time count, so it just represents one night in our city. The 2000 was an attempt to calculate the magnitude throughout an entire year for how many people experienced in homelessness during that period. The importance of a point-in-time count cannot be underestimated, however. Currently in Canada, there is no national homeless count, so we don't really know what numbers we're talking about, and as much as you don't want to reduce people to numbers, and that's not the point, to make arguments for policy change, to make arguments for more affordable housing, you need to have numbers to make business cases, and you need to make numbers to put some context around what a community is experiencing. So one of the initiatives I'm also involved in with the Canadian Homelessness Research Network and the federal government through the Homelessness Partnering Strategy is to create a national homeless count across Canada, so that on a particular night, every community would go out and enumerate homeless individuals. And that would again give us a sense of baseline over time. It would help us monitor trends, including whether the proportion of the homeless who are youth is growing or shifting in any manner. And currently, we don't have that information. So it's really tough to create systems to respond to something that we don't really have a good grasp on. The best figures we have, like I said, are the 721. But again, those can easily be argued against because they really are just a point in time. And one of the initiatives that I was part of when I was at the Calgary Homeless Foundation was to create an information system that looked at trends throughout the year and followed people as they moved through the system to get a better sense of what their needs would be. Unfortunately, that's just in its infancy. So there's going to be a long time before we actually have some of the critical information necessary to make the system work. And that's why public policy advocacy can't necessarily wait for the research. We have to keep going based on the information that we have. And some of the information that we have is actually very powerful. So in a study that was conducted from the University of Calgary Social Work, and I think, Stasha, you were involved in a study with Catherine and Bruce, they revealed some astonishing statistics, and there's no need to wait. I mean, this paints the urgency of the issue, and you heard about some of the pathways into homelessness that were already mentioned, but listen to some of these stats on street homeless youth. So about 43% reported childhood mental illness diagnosis, 75% reported being the victim of violence. In terms of substance abuse, 94%. Engagement in survival or obligatory sex, 20% of male and 33% of female. So again, abuse, family disruption, involvement with criminal justice systems and child intervention services, and of course, poor educational outcomes, not surprisingly. These are all common factors that not only show up in the individual stories that we hear, but they show up on a population basis as well among this youth. So what is it about this population that makes them more vulnerable to homelessness? Again, the developmental stage of youth, they cannot be assumed to be the same as adults. We can't expect youth to get a job and get off the streets, right? They're 12 years old, they're 13, 14. That's just not a reality. Youth also face discrimination in the housing market. Landlords are not going to rent to a 16-year-old. I'm pretty sure 16-year-olds can't even hold a lease legally. So that, again, this complicates their pathways out of homelessness as well. The gaps in social services that I mentioned before, while youth may be perfect candidates to get access to income assistance so they can go to school, get access to housing, etc., some of them are not eligible for that assistance. Those that are very vulnerable and are involved with the child intervention or correctional system already, because of the backgrounds that were already mentioned around abuse, etc., the lack of discharge planning out of those systems gets people in vulnerable situations, and they end up in the cycle of homelessness as well. So all these pieces that I'm mentioning around poverty, lack of affordable housing, the disconnect between the needs of youth and the public systems that are designed to serve them, all these are public policy issues, and so they require a systems response rather than an individual response. And those, of course, have to be complementary and aligned, but we can't forget about that higher order of work that needs to happen and the advocacy that we need to do as community members with our politicians and administrators within our systems as well. Next slide, please. This is just a pie chart showing you the statistics and age distribution of the homeless population in Calgary, and highlights the age ranges as well. And I'm going to make this available to you guys, the presentation, if you want to get a sense of the numbers in more detail as well. Ending homelessness, that's the next slide, please. Okay. So what is it going to take to end youth homelessness in our city? The good news is that we do have a plan to end homelessness in Calgary, and there is actually a youth plan as well. There's a youth sector, so that's a group of agencies as well as public system partners that work together towards implementing the youth plan to end homelessness. We also have news that there is a provincial plan in the works that is meant to address youth homelessness at that level. We haven't heard about its release yet, but we know it's in the works, and we know it is aligned with the priorities that the community had set out to achieve in the plan. That inclusive definition of homeless youth, so not serving the aims of legislation or the aims of programs or the aims of public systems. It's about wrapping the supports around the youth based on their needs. So it's client-driven and rather than system or program-driven supports. Enhancement of access to services within child intervention services. We have a wonderful act in place, that the Child and Youth Enhancement Act, that gives youth access to financial case management support, etc., to address some of their housing stability issues, etc. But many of the youth that fall through the gaps don't actually end up having access to some of those supports because of issues in the definition of youth that I mentioned before. And then developing and implementing appropriate interventions around housing and supports. I think you guys have heard of the term Housing First already tonight, or it was briefly mentioned. Housing First essentially means that you're rapidly rehousing somebody who is homeless, and you're providing wraparound supports to ensure their housing stability long term. Housing First has been very successful with some populations, particularly chronically homeless adults with mental health and addiction issues. But there's also been some experimentation for how to adapt that model to youth as well. And it's not a straight across cut and paste by any means, but there are experts who have been able to adopt that model, and Boys and Girls Club Infinity Project, for example, is a Housing First project that targets homeless youth with fantastic results. So having those types of initiatives in place that are well funded and aligned with Housing First principles, so that youth are met with non-judgmental approaches to case management, that youth are involved in their housing process, etc. That's really key to ensuring that the system is actually responding to their needs. The housing continuum for youth, so having a range of housing and supports, whether that's a group home environment or individual housing, so somebody that lives independently in the private market, again, based on their needs, preferences, capabilities, and really their willingness to take that housing on. Again, the choice has to be there for them. And then data and research. I mentioned HMIS, which is this integrated data system. Without understanding the population and understanding what's working for whom and what emerging trends are happening in the community, we're really not going to be able to know if we're on track to address the issue or not. And this is the last slide. This is just, the second to last slide, my bad. This is just a visual representation of a homeless serving system, and these are the basic building blocks that a well-coordinated response has. The housing instability and housing loss for the youth that leads to good entry and engagement processes. So the outreach work that Stasha is involved in is an example of that. You have consistent intake and assessment processes so that youth don't have to go like we were trying to find the bathroom here today, right? You know, you don't want youth to have to go to different doors and not find the right one, right? You have to have a system that's clear, transparent, and easily accessible. And ensuring that based on acuity and youth's choice, you have a range of housing supports available to meet their needs. So all those pieces need to be there for the system to function well. And if one of those is missing, then you're going to have system failures and ultimately leading to poor outcomes for the youth we're trying to serve. Okay. And then this is truly my last slide. It's a point about system integration. We can have a fantastically coordinated and transparent youth homeless serving system locally, so that includes agencies like the ALEX, etc. But unless those systems articulate around the goal of ending homelessness for youth with justice, health, child intervention, and those public policies are addressed, really we're only responding to an issue in a localized, one-off manner. So that work has to be uploaded back to public systems and at the federal, provincial level, and surely a municipality has a role to play through affordable housing as well. So that's that's my presentation. Thank you.
Okay, thank you for having me. This is a very exciting panel so far. I'm just going to wrap it up and then we can get to questions. So I believe in reciprocity. So if you're going to ask me questions, I am going to ask you some questions too. Eh? So stay awake. Okay. So I wanted to start with this cartoon because I think it's very timely and important when we're talking about what it means to be in a community. And this word charity, what does this mean to us? So in this cartoon, the guy is saying to these people, sorry, I'm not going to give you the stable for the night because that would destroy your incentive to better yourselves. And this expresses an idea that is called neoliberalism, which is affecting many, many of our communities and our policy and how we elect our governments. And so I think it has a lot of relevance to this issue. So the charity model is kind of how social work, that's my profession, how it started. And the charity model has quotes like, beggars can't be choosers. We'll just go back to the cartoon for a long time here. We're just going to look at that for a while. Thanks. So beggars can't be choosers. So what do we think about someone who would say a sentence like that? Because that's why people donate expired food to the food bank. Because it's good enough for them, which is separate than us. And as long as we're doing something like that in our communities of us and them, and those are other people's children, and we're not responsible for them, I don't think that we're behaving ethically. So the charity model sees some people as the givers and some people as the receivers. And I think that the way we heal that is by admitting that all of us is both. That we need to live in communities where we have opportunities to contribute in a positive way, that contributes to our identity, and that we can also access for help. So there aren't some people who are needy and some people who are perfect. That's not the world that I live in, and that's not how human beings are. So I think the way we challenge this charity model is if you are deciding whether someone deserves a house or if they don't deserve a house, then we've already gone down the wrong path. So that Alina referred to housing first. Housing first is the idea that housing is a human right, and that's how the UN feels about it, and is trying to shame Canada into acting like that. So Canada is one of the few developed countries that does not have a national housing program. And that means that responsibility falls to the province and the municipalities. So I have a question for you. How much is a welfare check in Alberta for a single person? How much of that welfare check is designated for shelter? And we're not leaving till you answer. Yeah. Yeah. That's right, it does. Yeah. So we're talking about, I'm so glad you came, first of all. Everyone should be, exactly. Everyone should be able to answer that question because people are judging without that kind of information. Whose rent or mortgage is more than $323 a month? Who? Oh, I'm coming to live with everyone who's not got their hand up. I'm going to keep my eye on you. Okay, thank you very much for that information because that really puts it in context of living in Calgary, where average rent for a one-bedroom apartment is more than $1,000, and we know what our vacancy rate is. So this is what Alina's talking about when we're talking about how systemic issues are kind of important to consider here. Otherwise, we're blaming individuals for systemic problems. So I think if we're judging whether someone deserves housing or not, lots of people who are on welfare are told by workers, professionals, and people on the street, oh, you're just a bad budgeter. Well, 0 plus 0 equals 0, doesn't it? And you identify... Sorry, I can't hear you. Okay, we'll get to that. The other thing that you were talking about is appropriate housing. So if you get a housing placement that is 3 hours away from your job by transit, right? Or if you get housing in a neighborhood where your children are going to witness domestic violence and community violence on their way to school. So these are the things we're talking about. That sentence, beggars can't be choosers, that is very destructive. That is a dehumanizing statement. I don't think anyone deserves to get, people donate expired baby food to the food bank. I don't think that shows ethical thought or community care. So that's why I thought we'd start with the charity model here. So in everyone's family, there is someone who is struggling with something, with trauma and loss and grief, with drug addiction, with mental illness. And I think that people, even within their own families, try to distance themselves from those kind of problems. And I want to live in a community where it is safe to talk about trauma and loss, because that is actually what unites us as human beings. That's a common experience that we all have, no matter where we come from, where we're born, what we're dealing with. We all know trauma and loss on some level. So when Jeannette is talking about how youth who are homeless by definition have suffered traumatic loss, and that homelessness itself is an experience of trauma, and that now we're judging individuals for their response to trauma, their coping strategies, that just compounds the problem. So we are not facing people who've been hurt with empathy and compassion. We're telling them they don't deserve to live inside. So I think it's very important when we're talking about these issues that we're not talking about problems with individuals. We live in one of the richest places in the world. This is not about scarce resources. This is about how they are distributed, how we prioritize things. So there are 2 nets that are supposed to catch you so that you never end up homeless. And this is why a lot of researchers are framing homelessness as either an extreme form of poverty, because your basic needs are not met, as a symptom of policy failure. That our society, our nets have so many holes in it that people are ending up homeless in one of the richest places in the whole world. So the 2 nets that are supposed to catch you are friends and family. In Alberta, you are encouraged to pawn your wedding ring before you go access a welfare check, and I don't think that's right either, because the next net that's supposed to catch you is government supports. Okay, new question for you. Why do women have smaller pension checks than men? Good answer. Smaller salaries. So tell me, what work are women doing that's unpaid? Housekeeping. Oh, raising the next generation. Do you think that's important? Oh, good answer. Okay, so the reason I bring up this example is because, sorry? That's why I'm talking about pension checks. So those people are over 65 right now. So I'm talking about that generation right now. So maybe that's going to shift. The reason that's important is because there is a high number of senior females who are staying in the adult homeless shelter because they're on such a low income from the pension that even if their property tax goes up and they own their house outright, they can be at risk of homelessness just because they are living on such a tiny amount of money per month. And the reason that that's not recognized is because of sexism, is because care work in the home is undervalued and underpaid. Childcare is one of the lowest paid professions in Canada. So when you've got frontline youth workers up here talking about the tireless work that they do, you know the average salary is $12 an hour, which is not even a living wage for Calgary, Alberta. So these are some of the systemic issues. I was surprised by how many seniors were at the drop-in center when I worked there. And I'm just trying to give you an idea of if government supports are not enough to live on, the percentages of people accessing the food bank who are either on government supports, which includes pension, EI, welfare, and AISH, or who are working full-time. That means that a full-time job is not enough to eat in Calgary. And that means we need to examine these more systemic issues, right? So maybe pension will be more fair soon. Don't get us started, eh? You see what happens when I ask you questions? Just get out of control. So I think part of this is when we're thinking about things like beggars can't be choosers, we also have to identify what people are choosing between. So if a 15-year-old girl in Calgary phones all the youth shelters and all their beds are full tonight, and she decides to take crystal methamphetamine so that she can stay up all night to protect herself from sexual assault, what alternative do we have to offer her, right? In that moment, she's choosing something that's helping her cope. But we want to create situations that help people heal. And the difference between coping and healing is safety, is having that sanctuary, a safe place to be. And that's why I think housing is a human right and not a privilege. So I want you to think about what you think about that. Do you frame housing as a right or a privilege, and why? And what does that mean for our policies? So I want to live in a community where there's not people who are needy and people who give them things or rescue them. I want to live in a community that has reciprocity, where people don't try to turn away from trauma and loss, that even though it's painful to hear those stories, even though it's painful to think about a world where a child's caregiver, instead of taking care of their basic needs and helping them grow, would abuse them, even though it's terrible to look at those things, that we know that it's more terrible to look away. I don't think that adults as community members understand the importance of their role in protecting children. So when a child discloses abuse to a teacher or a parent or an adult that they trust, that is one of the most important times in someone's life. Because if that adult tells them it's their fault or turns away, they may never share that again. And that closes down their opportunity to heal. Then they're just coping. And that's when we see things like substance abuse, like people thinking they're not worth saving. So I think also when I was homeless, it's interesting how much you get to know people. So if you're panhandling and people won't make eye contact with you, that does erode your humanity, your sense of worth as a human being. And that means that the opposite positive thing is very true as well, that you can make an enormous difference in someone's life by treating them like a human being and by looking in their eyes. Next slide, please. Soon, I swear, I only have 2 more slides. Okay. I'm glad you're excited though. I like it when you participate. Okay, so this is a quote about radical hope. Radical Hope is a very good book by Jonathan Lear, which is about surviving colonialism. What happens to a culture when you... What radical hope is going towards the unknown good. So the kids that me and Danene and Shannon work with, they don't even know what it's like to be safe, or what it's like to belong, or to be loved. And so it's very difficult to go towards something that you don't even know what it is, right? So a lot of kids who run away from abusive homes, they are going to the streets, which is very violent and dangerous as well. And so when you say that they're choosing homelessness, that's what I mean. You have to look at what they're choosing between. So I also wrote an awesome book about radical hope. Just put that out there. And that was about Youth Recovery Coalition was the agency that we founded to me and other concerned youth workers to work with street youth, and we ran that on the peer model. And the reason we ran it on the peer model means that all the staff who worked there, including the practicum students and the board of directors, all had experience with being in the child welfare system, with going to jail, with drug recovery, with being homeless, with being in poverty. And the reason that that helps to heal guilt and shame is because it removes the judgment of who deserves a house and who doesn't. And it also provides role models and hope that people have gotten out of that situation. So a lot of youth workers come from a similar background to the youth they work with, but they're not always comfortable sharing that. And sometimes it's discouraged to share that because people feel more comfortable when there's a distance between the client who's accessing services and the expert who's doling out the services. And similar to the charity model, I think that is a very damaging construct because we are all both clients and experts, and we need to be able to access those different parts of ourselves to make a difference. So part of the reason that I was able to save my life, there were two parts of that. First, I had to think I was worth saving, despite all the messages to the contrary that I received constantly through the trauma and abuse that I lived through. And I had one human being who cared whether I lived or died. So this is a story about youth work. So this one young man, he got caught for dealing drugs, and he got an adult drug charge. So he was 19, so this is a serious business. He can never go across the border. There's all kinds of ramifications to that. Things about employment, huge barrier, right? And he said to me and my coworker, he said, "I wish you didn't care about me." And I didn't really understand what he was saying at the beginning, because why would that be a bad thing for me to care about him? And this is about accountability. If I didn't care about him, then he could go off and destroy himself. But because I did, he kept going. And that is the biggest protective factor, is having one human being who cares whether you live or die. And that person does not have to be a professional. And sometimes it's easier to be that human being and be genuine when you're not a professional, right? And that's what I wanted to remind you about today. And my main message is that we make a difference on that level, human being to human being, when we can see each other, when we can see what we have in common instead of what makes us different. So yes, I do want you to think about that person as you, as your daughter, as connected to you. And I think we have to start in our families, right? And I think radical hope has important implications here because we are the ones who will envision a better world. I think that we should not be explaining to the next generation why the numbers of homeless kids are so high in our town, right? That doesn't make me proud. That's not something I want to pass on to the next generation. Next slide, please. Oh, can you even see any of the words on there? Okay, no, I'll tell them to you. So this is from Youth Recovery Coalition, developed like a moral code. This is the medicine wheel of healing. So this comes from First Nations teachings that we've had about balance in our life. So this is about 4 different areas, mental, emotional, spiritual, and physical. And we developed this because the street youth have a very strong moral code, because all you have on the street when you've lost everything, when you are connected to nothing, is your integrity. So I think we have a lot to learn from them. I think we should try to be more like them. Because an important part of trauma, yes, everyone who's homeless has lost something, huge things, compound things. Most people have been hurt in more than one way. But there's also something called post-traumatic growth that happens at the same time as the horrible experience and symptoms of trauma. And post-traumatic growth is the wisdom that you develop when you realize that people are not all bad or all good, that all people have both inside of them. The same as being needy and a rescuer at the same time. And you also develop an appreciation for life. And you also know who your friends are. So there are lots of things that come from trauma, from having the foundations of your life shaken. You develop a stronger foothold as well. And I think that's really important, because we can get bogged down by the trauma and the pain, and that makes us want to turn away. And if we know that there's something good still there, and that it's actually caused by the trauma, and the more traumatized you are, the more growth you have. So we have to support that kind of transformation as well. So a big part of my experience has been turning my trauma into learning and my ability to teach and share with other people, so that we can work on these problems, so that we can look at these issues together. A big part of being a teenager, your main job, is to develop your identity. And we know this is a messy process. We know what this looks like, right? You're trying on different hairstyles and different ways to express yourself, and seeing the power of swear words, you know, all kinds of stuff. An identity is developed in relation to society, right? In the reactions that you get from what you put out there. And so we are part of shaping these young people as well. And I think we owe them a chance to have that positive identity. Because you're right, when you don't have family, it makes you very at risk for being recruited into gangs, being recruited into sexual exploitation, and being hurt. So we have to provide an outlet for that. Many of the homeless youth have never met a senior citizen, let alone had the opportunity to learn from them. There's intergenerational knowledge that needs to be passed on, right? They think potatoes come from Safeway. We need an intervention, right? So pursuing identity is tied with pursuing your sense of belonging. And that is a very, very basic human need, is the sense of belonging. And I think if you think about your own identity, it all is relational. You're someone's daughter, someone's mother, something of how you give back to your community and what you have to give to your community. So if we just frame street youth as victims, we're kind of cutting off their opportunity to give back to their community as teachers. And I don't think that we should do that. Because they've taught me a lot of things, and they get a lot of wisdom from their experiences. So the way that I describe this duality that we have of being both needy and givers, being bad and good, having wisdom and shame, is to call it a veggie burger with bacon, which is very tasty. You should eat one and be one. So what I am asking you for today is to be a veggie burger with bacon, which is to see yourself in that homeless youth and to see that homeless youth in you. That's what I got.
You can see why I subtitled this panel A Complex Approach to Understanding Relating to Homeless Young People. This has been very, very rich. I want to pay tribute to Danene. She hasn't yet spoken, but this panel wouldn't be here, at least much of it wouldn't be here without Danene. So public thanks to Danene. I'm going to ask the first question. And the first question is for Jeannette. Tell us a little bit about your new book that's going to be coming out soon. I forgot to mention this earlier.
Oh, I'm not used to speaking about myself very much, but I am excited about this, and I'll try to make it very short. Several years ago, we developed a certificate program through continuing education at the university, and the certificate program was addressed to helping frontline workers who work with homeless people to develop skills and knowledge that they could take back and use on the front lines. What we learned from that experience was a whole lot of information, and realized that there was no book that adequately captured even a smidgen of it. So I wound up over the last year when I was on sabbatical writing a book called Working with Homeless People, Basic Skills and Practices. And I received word from the editor of the publishing company that I just need to make some minor changes before it actually goes to press. So hopefully in a few months it'll go to press. What makes it exciting is that there is no comparable book like this anywhere in the English-speaking world, either in Canada or the US or over in Europe, Australia, New Zealand. The other thing that's interesting about it is I've written it for a North American audience, so that where we are different from the United States, I have different sections that address homeless issues in Canada as opposed to homeless issues in the United States. I worked in the States for quite a number of years, so I understand the policy and practice models down there fairly well. So I'm kind of excited that this book is finally going to see the light of day, and hopefully it'll be of use to the community.
Great.
Okay,
Thank you. Jeannette. We do have some time for questions or comments. So I see a couple hands at the back. Yes, go ahead.
This is an excellent question that everyone should send to their provincial representatives immediately through Twitter, email, and by mail. Honestly, we have been trying to advocate to increase welfare rates for 25 years in Alberta. Rent has not been $300 at all during that time. And this is what I'm talking about when I'm talking about the damages of the charity model, of this idea of, these are actually called government entitlements, but then they question who deserves them and who doesn't. And starving people to death who need money does not end poverty. Good question.
Also at the back.
Come use this mic. Well, I'm not a great person. I did his homework. You got something to say.
Well, it may be the only opportunity. It's taken me many years to get here. Thank you. Good evening, everyone. My name is Paul. I would like to thank Stasha Huntingford, Danene, Lenstra. Sorry, I'm a little nervous. That's why I put it on paper to keep accurate. Shannon Jones, Alina Turner, Jeannette, Waegemakers, Schiff, and Douglas Shannon, the other people that have been introduced tonight, the Reverend and other people who are here and support, and especially someone who's been behind me, who is youth, and he's been beside me, and it's taken a long time to get here. Now I'll stick to the paper. I was born here in Calgary, and I've seen this city I call home grow to be a big city, but also remembering as a child what Canadian life and standards were like. Tonight we're talking about homelessness, the causes, effects, possible solutions, or just healing from bad past experiences. Growing up here in Calgary taught me a lot of good things, and how if communities are healthy and communicate well with truth and integrity, then we have healthy communities. Of course, there has been stumbling blocks along the way, but nothing that could not be resolved. So I do not take up too much time and end up writing a novel. I will start with my experience with homelessness and agencies trying to help. Before I got injured on my job, I was a surveyor, field engineer. Unfortunately, that caused my life to change. Around this time I was injured. I worked for the biggest oil companies, in oil and gas transmission and development. So I've also seen how big companies work. So I was used to policies, procedures, and how things could go from something bad, if something bad happened and we continue on working long hours for weeks and months on end and thinking that we are protected by our employers, healthcare, WCB, or insurance, or if something happened. Then something happens and we quickly start to see a new phase of life beginning to form. After going through years of imagery, diagnosis, surgeries, physio, and so many other new hoops that you learn, or hoops you need to learn to jump through, rather they are teaching you to jump through hoops. And you realize that these people do not care about you at all, and that it's a big bad game into a bureaucratic mess that is designed to steal your life, health, and the ability to make decisions on your life based on your life. But now you have someone looking for a bonus to ruin your life. So far, what I have stated has been a brief, very brief intro, and now time to get what matters most. Not just words or feelings or emotions. I will skip ahead through years and years and many stories and start with documented, recorded facts that occurred while trying to keep a roof over my head through all these injuries. And to this point, I had only minimal interactions as my trust in the system was non-existent. Remember, I worked for big oil companies, learning policies, adapting, being safe out in the wilderness, many things, and I thought policies and people with integrity were there, and I've learned otherwise. It was trust the system. Then they basically broke my door down into my life, and not in a good way. And why I had done things to this point my way. It was a building in Lower Mount Royal that was previously owned, and I got along well with the owner and supervisors of the building, because that's what Calgarians and real Canadians are there for: communities, neighbors, people that can trust you, not someone that you need to call on a telephone and say, I'm there to protect you. We protect each other each and every day. Well, that's what Calgary, I used to know, stood for. It hasn't been looking that way lately. This is where the story really begins. Then at Christmas time, 2011, the owner announced that for January 2012, a new owner called Fireside was taking over the building. Remember, I was 8 years there, learned to live on $467 when my rent was $575, not being involved with any food banks, and knowing that my priority first was a roof over my head. Living through all these before the Calgary Homeless Foundation came into my life and broke my door down, because they're the ones who took over that building. And there's a sub-member on here today, and they've been wondering why I've been absent and where am I? Well, I'm here tonight, and it's the best venue possible because I'd like to also thank Jesus for giving me the strength and keeping me alive and understanding that we all have to stand up and talk the truth. The truth is the only way to set you free. Right at the start, it was no trouble, no proper contact or emergency info at this building when they took over. The supervisor was on site. This guy didn't have any training. There was an issue when the building boiler, because it was a transition into spring and the building got up to 95 degrees Fahrenheit. And because of my knowledge of being an engineer, that's why I introduced myself the way I did. I stopped the building because the person who was there to protect the 15 suites and how many different people living in this building, who knows what would have happened. There was people on this site that did not know. The gentleman, that's the respect he thanked me. I don't even want to name him. He was just as scared going, you're right. How do I come in as a new immigrant and someone puts me into a temporary job and says, here, be a site supervisor and a building with a new boiler that should have no problem, and it's because no one knows the policies and procedures of takeovers and whatnot. I'm sorry. I'm trying to stay focused to this paper. That's why I'm saying I could be here for a law. Thank you very much for your support. Well, the hard part is I wanted to come here more prepared, and I was thinking about this for all the weekend, and I knew if I didn't just try to keep it to here that things would just happen like they're kind of unfolding now. In the last 10 days, there has been issues in the mainstream news that talk about what happened. Their first communication, Calgary Homeless Foundation, was a fraudulent energy contract. This has now been in the news in MSN, or mainstream media, that they're talking about it. When I phoned and addressed it, it was closed. When I was evicted, Global Calgary told me that they're coming to see what was happening. They said that they would be there. Did they show? No. When it comes to truth in media, and when people want to conveniently hide behind, because let's face it, when we look at our news stations, what do we see? Pre-programmed, scripted, fake. There's nothing truth. Sorry? Well, it's just the truth. Isn't that what we're all here for as humans and what to learn? We don't need to hide behind scripts. You don't need to be Morgan Freeman and say it accurately and in a certain way, and your hair's got to be this way or that way, and the different colors and whatnot. Do people understand that what's in your spirit that sets you free is the truth? And yet there's people here that in what they have mentioned, and I have more than enough recorded evidence that, I know, thank you. Thank you, I will. Would anyone?
Don't know if the supports are there until you try to access them.
Right? So a really important thing that he's saying here is you don't know if you can access supports like EI until you try to access those supports. So this causes misunderstandings in our community because people who have never tried to access some of those government programs assume that they would be there if they tried to access them. And we're mad at unions and the media also. And nursing.
Couple more minutes?
If that's possible.
Sure.
Yeah.
Let's give Paul a couple more minutes. He's making some good points.
Thank you very much,
Okay.
everybody. And thank you, Stasha. Around the same time that changed their name they changed their name from Fireside to the Calgary Homeless Foundation. As I progressed and started recording and documenting the goings-on, reconstruction of the building started in about May, and they said they were doing repairs, but it wasn't repairs. It was major renovation and reconstruction, while 15 units were still occupied and not properly informed of the situation. At no time was there any permits for this site, but because of my career background, I knew who to call and what was required. A part of me that instead of being hidden and whatnot, it was time to stand up and be that sacrifice, knowing of what it was like to be a successful surveyor and then be in this situation going, I'll be there for those and see what people go through. And this is the statements then what I lived as an underground seeking truth. So I see a major problem occurred. They started working 12 hours a day, every day for months on end. Roof repairs, sledgehammers. I'm not going to get into, okay, I'll stay here. The types of 24-hour notices that they gave were a joke. One lasted for a whole week, from the hours of 8 to 5, where at any time they could come into your residence because they need to access it. A total of 130 plus hours of access to your suite when they only needed 2 hours. The psychological warfare going on in this building was intense. And in the background, knowing who I was and where I came from, it was like it was designed. There's many times the doctors gave me pills. Things really fell apart. Now, the hard part, I'll fast forward over that part. And the thing is that, here's the hardest part. This was at the same time I got home, I better read. The building permit wasn't issued until mid-October and placed in the appropriate place, mid-October. This was the same time I got home from the hospital because the CHF, Calgary City Police Service, had kidnapped me and 2 weeks kidnapped me 2 weeks earlier. I was released from the hospital with no mental health certificates in place, clean bill of health, and a doctor stating that my quick executive decision thinking process was quite intact considering what was happening. While at the hospital, the CHF filed papers for my removal, yet they knew I was in hospital based upon fraudulent statements submitted to the CPS. The doctors couldn't help but notice, and while the hospital was forced to have a residential dispute commission hearing where the CHF, and this is in hospital, CHF representative perjured himself in the presence of 2 doctors. There was a second hearing where I could present evidence and was shut down because the CHF removed that I was going to be paying their legal fees. And that's because I actually was able to finally show up there and start to fight. And they went, no legal fees, you're shut off. All the things that, like this piece of paper, we're not listening to you. Case closed in their eyes, even though perjury and all these crimes, stealing of public property, falsely making statements that had me in a mental hospital for 2 weeks, that I had to prove myself sane, and I did. Calgary Homeless Foundation, you lose that way. Yeah. The building, there's more to say. The most important part, we can talk afterwards, but today there was 2 key things that happened. I got to know somebody that lives in that building, and she told me what's happening. That building is now being pulled. It's not going to belong to the YWCA Homeless Women's Shelter, is what I was told today. I also saw on the Calgary Homeless Foundation website that the CEO resigned in the last 2 weeks. They have a statement saying they have a 10-year plan to end homelessness. Remember the story I'm telling you. I did not become involved with the Calgary Homeless Foundation. I was dealing with this all on my own. They broke their door down and they made me homeless. That's the most important. I didn't know what it was like to be homeless until the Calgary Homeless Foundation made me homeless under false accusations and at SWAT team gunpoint. Thank you for listening.
Okay, thank you, Paul. Okay, I think there's a takeaway message here, and that is that the conversation has really only begun. Let's meet around refreshments, and let's give thanks to our panel.
Actually, and if you just bear with me for 30 and a half seconds, there are a couple of points that haven't been raised this evening, and they pertain to youth homelessness. And there are ones that have bothered me for time immemorial, maybe before Jamie even. And the first is that our child welfare system, I know that for whatever we think of the child welfare system, it's supposed to be there to provide protection and supports the children up to the age of 18. But the reality is that the minute that a kid hits 14, they don't even want to look at an adolescent beyond the age of 14. And so we really have a system in place here that should be providing supports and protections. And I'm not necessarily saying that these children should be put in foster homes, but we have a government department that's supposed to be providing some kind of care, and that for me is financial care and appropriate care in the community for these adolescents that are unable to remain within their own homes. And so I think that each and every one of us have a responsibility to let our MLAs know that child welfare has to do something to be looking after our youth up to the age of 18. They haven't been doing it, and they should be doing it, period.
Thank you, Jeannette. If you'd like to be on a mailing list for future Christian Thought events, they're not all as exciting as this one, I can promise you. But there'll be a sign-up sheet on the table. Thanks again for coming.